We've added each of our board meetings an update on our COVID work, particularly under our Health and Human Services Department. We'll also get a brief update for Clean Water Services as well. So we'd like to welcome both Marni Kuyl, our Director of Health and Human Services, as well as Mark Jockers here for Clean Water Services. So we'll turn it over to you. Thank you.
Good morning, Chair Harrington and Board. I'm Marni Kuyl, Director of Health and Human Services. So for this morning, I'm going to provide you with the latest numbers for Washington County and the state, a quick overview of our Emergency Operations Center and the work that's being done there, including the work that the Public Health Branch is doing, review some new guidance around face covering that we've shared with our staff, and a quick review of our communication plan in Washington County through the EOC. So I'll start with the numbers. As of this morning at 8:30, Washington County has reported since the first case on February 28th, we have 283 people who have tested positive, and we've had 6 deaths. In the state of Oregon, yesterday they reported 233 new cases for a state total, cumulative total of 1,132 cases with 27 deaths. In Washington County, since February 28th, we've tested 3,376 people for COVID virus. We continue to work on 2 long-term care facility outbreaks, and we have 2 other what we call clusters, meaning that there's at least 1 resident or staff person who is COVID positive or symptomatic in a long-term care facility and adult foster care homes. I wanted to let everyone know that Oregon Health Authority has released a new data dashboard for visualizing data related to the outbreak, and it can be accessed on the OHA website. A couple of new department operation centers have begun operating. So Washington County Sheriff's Office activated their Department Operations Center yesterday, as well as the City of Tigard has also activated an Emergency Operations Center. So our County Emergency Operations Center will be sure and coordinate and communicate with those new Emergency Operations Centers. In logistics, over the weekend on April 4th and 6th, we received 2 orders of medical personal protective equipment. And as a reminder, OHA is the one that provides personal protective equipment, so masks, gowns, and gloves to the healthcare system and the hospitals. The PPE, or the personal protective equipment that we receive at the county, is for other sources such as emergency medical response system, fire departments, law enforcement, and others that may need PPE because of direct ongoing contact with patients or people that are symptomatic for COVID. We have in our EOC an Essential Services branch, and they've established weekly calls with the Interfaith Network to coordinate local COVID response efforts like donations and deployment of those donations to meet the needs of vulnerable community members. The branch has also added additional staff to focus on the financial resources that our community residents need. The county issued new guidance yesterday to employees regarding CDC's face covering recommendation. So we're in the process of ordering cloth face coverings for use by county staff who are unable to telecommute and who have to continue to come into the office. As Chair Harrington said, the work of the county has to continue. I brought a couple of samples of the face covering, and just want to remind folks that we're asking that non-medical staff, so if you're not a healthcare provider, you don't have direct patient contact, you're not an emergency medical services provider, fire provider, that you should not use an N95 respirator or another surgical mask. We're asking that the general public, including our employees, use the cloth mask. And I have a couple of samples that I've brought as to show you what these look like, but our board is modeling very well the use of the cloth masks. In the instructions we gave to our staff, it includes the really important message that these cloth face protectors do not replace our need to social distance. We still need to stay at home as much as possible, telecommute when we can. We need to continue to wash our hands frequently and use hand sanitizer or soap if soap and water are not available. Covering our coughs and sneezes with a tissue or in our inner elbow. Maintaining the physical distance of at least 6 feet from coworkers or the general public, and then frequent cleaning of high-touch surfaces. We're beginning to see some progress and beginning to see what might be positive flattening of the curve, reducing the number of people that are seen in the hospital and the emergency room. So it's really important that we keep up these social distancing efforts and that we add the mask when we're in public and may not be able to maintain that social distancing. For our staff, we provided instructions for using the face masks. So just a couple of things that we're making sure that our staff know is when you're handling the face mask to use the ear elastic or the ear attachments and put it on your face. And avoid touching the center of the mask on the inside or on the outside of the mask. And the same thing when you remove the mask, use the ear attachments, take it off without touching, and to place it, and I don't have one here, and this is just for demonstration purposes, but you would want to place it into either a plastic container that you can wash or a paper bag that you can toss out. The masks that we're using, the facial coverings that we're using, should be washed every day, and they shouldn't be shared with any others. So we also provided instructions for making the cloth masks, and we provided instructions for those who are able to make them and want to share them with coworkers, how you can do that safely so that you're not contaminating a mask and giving it to someone else. The basic instructions are when you finish making the mask to wash it, dry it, and then touching it as little as possible, put it into a single-use Ziploc bag so that you can hand it to your coworker. Again, washing your hands when you put it on, before you put it on, when you take it off, and be sure to wash your hands when you're putting it in a Ziploc to share with somebody else, an unused mask. So that's the instruction that we've provided our staff for using the masks. So the other thing that I wanted to do is just to highlight a little bit of our communication that's happening throughout the county. We have a COVID-19 website, and so we've been able to update the overview page, and we have links in several languages, in all languages. We've added the information about the face covering, and we've begun to focus on helping people coping with anxiety and stress related to the stay home and save lives. We've also had Facebook postings, multiple postings each day in the past week. We had one particularly successful paid posting that was directed at Spanish-speaking populations, where we reached over 12,200 people, and at least 2,170 of those people actually watched the video or clicked on to the links. So that's pretty darn successful. We've been able through Nextdoor, to post information about how you can report potential violations of businesses for the governor's order, and where you can donate PPE at one of our Blanton sites. We've had 12 media inquiries in the last week, and we hosted a press release regarding the Comfort Inn and Suite Respite Center, which is a homeless respite center for homeless folks who have COVID positive tests or are showing symptoms of COVID. We successfully opened that last week and have a few occupants, and we're working with the health system to make sure that they're able to get there when they need to be there. We also have a lot of outreach to vulnerable or non-English speaking populations through our community service branch. We've had twice weekly emails and phone calls with partners, and information goes out to over 500 individuals and organizations that have been involved. And that includes things from early learning, behavioral health, our migrant camps, people that work at the plant nurseries. The language is provided in multiple languages and is culturally relevant for folks to hear. For internal communication, we have had a lot of help from County Administrative Office, Philip Bransford. He is hosting a twice weekly coordinating call with over 200 public information officers so that they can exchange information and discuss our communication strategies. We also have published Chair Harrington's fourth public service announcement, and that has both Spanish and English subtitles. And we let folks know about that through Twitter, Nextdoor, and Facebook. And then we also, our interim county administrator, Steve Rhodes, is publishing a weekly email message to all staff, emphasizing the work that we're doing, thanking them for the work they're doing, and sharing any pertinent information. And Human Resources is also providing a weekly employee wellness newsletter. And as I mentioned, we did post the new CDC guidance for face coverings on our webpage. So before I turn it over for questions, I do want to give you one piece of really encouraging good information about one of our programs. The WIC program, in the midst of changing the service model from primarily an office-based service model where clients came into the office and were served either one-on-one or through a clinic-based group education setting. So as they were changing this model and as they were allowing more and more people to telecommute and performing phone visits and e-visits and really only requiring people to come in very minimally for things that they couldn't get otherwise, such as picking up breast pump supplies for breastfeeding, or if they needed their e-WIC card, they could come into the office with an appointment. But in the midst of making all of these changes, there was a growing need for WIC services in our community, and our WIC program was able to serve more than 350 new WIC clients. So that's 350 new women and children that were served in the midst of all of this change. We're really proud of Tara and the entire WIC team for being able to accomplish that. It's quite an accomplishment. And later, this is Public Health Week, and so you are going to get a presentation from Tricia Mortel, our Public Health Division Manager, soon, so that you'll get a broader view and opportunity to celebrate public health in general. So with that, I will open it up to any questions.
Do we have any questions for Marni before we hear from Mark?
I would just like to say thank you for all the work that you're doing in educating us and educating the public, and also the work that you are doing to keep your staff morale high. So thank you for that.
Thank you. It's an entire county workforce that's contributing, so we all appreciate it. Thank you.
And all of the employees, yourself included, have shown a great deal of dedication, but also versatility and adaptability as we have learned more from day to day, week to week on what we're facing as a community. So thank you very much for that.
Thank you.
Mr. Jockers, what's happening in the clean water services domain with COVID-19?
Thank you very much, Chair. For the record, my name is Mark Jockers. I'm the Government Public Affairs Manager at Clean Water Services, and I appreciate the opportunity to talk to the board today and also talk to the audience. Clean Water Services, like many public employees, are working 24/7, 365 during this crisis, as we always do. collecting and cleaning water from homes. We have 4 wastewater treatment plants, clean about 65 million gallons of water a day, and collect that through nearly 2,000 miles of sewer lines that connect to every home and business here in Washington County. One of the challenges we've been seeing during this COVID pandemic is an increased number of disinfectant wipes, baby wipes, paper towels, things like that that are going down the toilet. So they are going down the toilet, and what we've seen, not only here, but what has been seen across the country is just a surge in the number of household sewage backups, as well as what we see at Clean Water Services is we see plugs in sewer lines. We see these materials that do not break down. There's no such thing as a flushable wipe. The only thing that should go down there is toilet paper, is that binds up and binds into our pump stations, creating the potential and sometimes actually causing sewage overflows, which is a public health threat in itself, and we certainly don't want that at any time, but particularly during this time right now. So what we are urging people, and we are urging them as a water treatment agency, I think you see plumbing companies doing the same things, is do not flush paper towels, disinfectant wipes, baby wipes, even facial tissues do not belong down down the toilet. Those should go into a garbage can. So the only thing that goes in your toilet is bodily waste and toilet paper. That's it, and I would really encourage the public to follow those guidelines, not only to make sure they don't have a sewage backup in their own homes, but to make sure that we don't have problems in our community as a whole. So thank you very much.